Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. We continue with this month's theme of A Hunting We Will Go, and then go to the vet. Today's example is a 4-year-old male entire Boykin Spaniel who has a chronic cough for the past 5 months. The cough is productive and worse at night or when excited. He possibly wheezes as well. There has been regurgitation with intermittent frequency since he was a puppy. The symptoms were initially responsive to prednisone, ampicillin, and doxycycline for approximately 1 month. Subsequently, there was no response to cephalexin, ivermectin, fenbendazole, and antitussives. Currently, he receives prednisone. The cardiac silhouette and pulmonary vasculature is within normal limits. There is a moderate and diffuse interstitial pattern that is unstructured and predominates in the caudal lung fields. There is a mild and diffuse bronchial pattern that is also most severe in the caudal lung fields or lung lobes. As we zoom out, we appreciate that there is increased soft tissue opacity in the perihilar region. We've already described that the caudal margin of the cardiac silhouette, specifically the caudal cardiac waist, is within normal limits. And the presence of this increased soft tissue opacity is therefore likely arising from the lymph nodes, which also reside in this region. So for this patient, we have a mixed interstitial and bronchial pattern, as well as enlarged tracheobronchial lymph nodes. When we consider these findings together, our primary differentials are infectious etiologies, such as pyogranulomatous disease, which can be fungal or specific bacterial, neoplastic disease, such as round cell tumor, and bronchopneumopathy, such as eosinophilic or lymphomatoid bronchopneumopathy. The implication of the lungs and the lymph nodes is an important distinction in this study as it narrows down the categories of disease as we described to infectious, neoplastic, or inflammatory/immune modulatory. Infectious causes specifically comprise that pyogranulomatous agents that can target both lungs and lymph nodes. Fungal differentials include histoplasmosis and blastomycosis, amongst others, and some bacterial, such as Mycobacterium. Neoplasms are often limited to round cell tumors, such as lymphoma or histiocytic sarcoma, which can also manifest as masses within the lungs. And bronchopneumopathies can be considered, but are less common. They are typically responsive to steroid therapy as well. Be sure to check out the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.